I've done a few documentaries on sleep, and a couple of things are going to seem pretty obvious, but in terms of taking anything that's a stimulant close to bedtime, such as caffeine or medications that are stimulating, you obviously want to avoid those. There also appears to be this idea that there is a ideal temperature. Now, for people, it may vary a bit in terms of what is ideal for them to sleep, but usually between 68 and 72 degrees. So you may want to find your ideal temperature, and then try and really cut down on screen time before you go to sleep. There's been plenty of data now in children and adults alike that can keep you up as well. So why do you get backaches when you don't get enough sleep? It's interesting. Maybe it's part of the same problem. It could be that your bed is causing backaches and you're also not getting enough sleep as a result of that. People who don't get enough sleep do tend to have more problems with all sorts of what are known as myalgias, muscle pains in different areas of the body. The muscles that run up and down your spine, the psoas muscles, are some of the largest muscles in the body, so they're the most noticeable if they start to ache. But you might want to get the bed checked out and find out if there's something orthotic or orthopedic going on with your back as well. Yeah, there are definitely places where allergies are less prone. And I think about this because I have allergies as well. So living in drier climates, for example, may be better for certain allergies, more humid for other allergies. There are certain parts of the country, sort of in the upper Midwest, which tend to have particularly high pollen counts, and sort of from the upper Midwest all the way down to the south, that part of the country. So if hay fever, for example, is a real problem for you, you may want to avoid those places. Of course, you got to live where you live, so try and keep the pollen from coming inside. Take your shoes off when you enter the house. Close your windows. Get a good ventilation system that can make anywhere possibly inhabitable for you. First of all, you want to make sure you're actually talking about migraines. People use the term sort of generically, but a migraine is a very specific type of headache. And I'm someone who takes care of patients who have this, but also have had migraines myself. Typically occurs on one side of the head. May affect your vision. You may get blurriness of vision, for example. You may even get numbness. And older people, sometimes they think they're having a stroke. If in fact it is a migraine that you're having, one of the things that we know about migraines is they tend to be associated with vasospasm of blood vessels. So I don't know if the exercise is causing some difference in how your blood vessels, how much blood is actually getting through those vessels, but that could be a possible reason. There are different things you can do, including taking what are called prophylactic medications for migraines. So if this is happening a lot, you exercise a lot, you're reliably getting migraines in the morning, you may want to think about a prophylactic medication.